Correct.
Am I looking at the camera?
Yes. Yeah. All right. Okay, we start 1, 2, 3. Assalamualaikum warahmatullahi wabarakatuh. Today is very special day. We have our special guest next to me. I'm with Dr Hjh Amalinda, Datuk Paduka Hj Suyoi. She is the assistant breast surgery at RIPAS or GPMC.
Yes, associate breast surgeon.
Associate breast surgeons at GPMC. RIPAS and GPMC. Okay, both. So, Dr Hjh Amalinda just share with Brunei Green Club regarding breast cancer awareness. So, we have time to discuss something about breast awareness today. Doctor, perhaps you want to explain how actually breast cancer cases in Brunei.
So breast cancer, like everywhere else in the world, in Brunei it is the most common cancer in women. In Brunei our numbers are, we get over 130 breast cancers per year, and the majority of them, more than 99% of them are in women. And unfortunately these numbers are on the increase as well.
So, regarding that, is there any awareness that been conducted by either by Brunei agencies or any other agencies that been formed to specialize on this cancer awareness?
Well, in terms of increasing breast cancer awareness, we always do try to run workshops with schools and teachers where we give talks and we have workshops to show people how to, or show the ladies how to examine themselves, as well as what signs to look out for. As well as that, the government is again very the importance of awareness for all cancers is something that we emphasize. And we will hopefully be starting up something population-based. I can't say too much about it yet. It's still in the works, but again, in terms of improving awareness, it is improving. Thankfully, with the internet, with YouTube, it is on the increase. But again, something we still need to work on.
Okay. Something that I know about cancer is actually related to the lifestyle. Right. So, what kind of lifestyle is actually have a high risk to the cancer, and what kind of lifestyle that actually have low risk, and how we actually need to adapt regarding our lifestyle?
It's always important to have a healthy lifestyle. Obesity, for breast cancer in particular, we know that the very obese patients will have a higher risk of developing breast cancer. So again, we always do emphasize the importance of healthy eating. Physical activity, exercise, regular exercise does help to reduce that risk. Smoking is never a good thing to start, and we know there's an increased risk of breast cancer, lung cancer, and any other cancer actually with smoking. Similarly, alcohol as well for those that drink, again within reason. So in moderation, there's always something for anything, including diet.
Okay. Specific for the breast cancer. So, how actually we can have early detections, both for men. I noticed there's some cases of actually breast cancer on men, right? So, how actually we can do early detections on that?
There's no way to prevent. There's no way to prevent cancer. There's no tablet that someone can take, and they will never get cancer. But what we can do is to detect things early. So, in terms of detecting, say specifically for breast cancer, it's important for women and men to check themselves regularly, once a month is what we say. And again, it's about looking at your body, at your breasts, or for men, the chest area, see whether there's any changes that's there. If there are any changes that were previously not there, or getting worse or more obvious, for example, then that is something that we need to check. So early detection of cancer, it means that if there's any concern that you have or any abnormality that the person notices, they need to bring it to get checked by a doctor sooner rather than later, so that if it is anything to worry about that we need to treat, we can treat it when it's early and when it's small.
I understand that the bigger percentage of cancer is breast cancer, especially, is actually for women. Now, how we men actually can support or help women in terms of detections, preventions, or even in terms of support when they already diagnosed as breast cancer.
The support of family, husband, children, relatives, sisters, brothers is very important. Parents, of course, as well. And we do know that patients that have a lot of family support will do much better with the treatment. One, they will feel less scared, and then two, they know that when they're feeling unwell during the treatment, which can sometimes happen, that there's someone there at home that can support them. You know, even if it's something as simple as bringing them to the clinic and sitting with them in the clinic while they see a doctor, that helps a lot. And again, that's what the spouse, the men, the husbands can do for their wives. Similarly, their husband can also, before seeing, if the woman doesn't want to see a doctor, for example, if their wife has something that she's worried about but is too scared to go to get it checked out by a doctor, again, the husband can support and encourage her to go get things checked out, bring her to the clinic to see a doctor. Again, it's something that will help the ladies come in at an earlier stage, and to help them with whatever treatment they have to have that nurse support.
There's one question that actually pop up in my mind. How about the herbal medication? We are in, especially in Asia, we are exposed to all the herbal medication and so on and so forth. We tend to compare it with the Western medication. So what's your opinion about it?
Now, with herbal medicine, it's because it can be unregulated. So we may not know exactly what is in these various tablets, herbal medicine that people buy in any shop. Because they're not regulated, we don't know exactly what's in it and what the effect will be. We have some people wanting to try alternative medicines. It could be something natural, such as a particular plant or a particular leaf that they want to try and eat, or juice that they want to drink. And we do have people that say, "Oh, can you give me 1 month and let me try this." So far, no one has had success, unfortunately. So eventually they either come back to us with a lump that's very large, or they come back to us and say, "Okay, I've tried it for a few months, it's still the same," and we check it again with them. They also want checks, so we check it with ultrasound, check this out, still the same, and only then after that they're persuaded to go. So again, we have yet to find anything that's worked. And again, the treatment that we recommend, we the doctors recommend, is based on thousands, millions of women being studied. Tablets or medicines or techniques, even surgeries, that have been developed treating millions and millions of women, and we know they work because they've been tested with proper research facilities. So that's why we recommend what we recommend. In terms of the herbal medicines, we don't know. Simple answer is we don't know what's in it. It hasn't been tested properly. The best thing may be that it doesn't interfere with the treatment that we're doing. But the worst thing that could happen is that the herbal medicine makes things worse, or it could react with the medicine that we give and stop our medicine from working. So again, so we definitely wouldn't recommend it to people, because we just don't know what's in it.
Alright, great. So last, is there any message for my viewers, both men and women, regarding breast cancer, to be specific, or regarding any cancer?
I think what we always want people to know is that the doctors are there to help. If you have any, it's important to check yourself, and if you have any worries, lump, for example, the most common thing, or any changes in your breast that you notice, it's always important to bring things early. Because again, if a problem is left, as we know, left and not fixed, it will become bigger and it will become more serious to treat. So for the ladies out there that find a lump and are worried about it, please do get it checked out early. Don't be scared to go to the doctor. To the spouses, the husbands of the wives that have something wrong, support your wife. Encourage her to go to the doctor to get checked out. Okay? And a lump, it doesn't have to be painful for it to be cancer. Any lump, please do check out.
So, thank you very much, doctor. Thank you very much for your time. Once again, it is important for you to check any of changes all over your body. Don't afraid to go to the doctor. Please do some checking. And the most important thing is actually support those who already been detected with cancer, because the support, especially from the families members, is important for them. So that's it for now. Assalamualaikum warahmatullahi wabarakatuh. Thank you, doctor. Thank you.